Us now is a medical doctor, coordinator, Christ Against Drug Abuse Ministry, KADAM, Dr. Dokun Adedeji. Good morning. Thank you for joining us.
Nice to have you join us.
Thank you to be here.
Now, talk to us about the complexity and the severity of drug abuse, especially in Africa.
I'm glad that we're talking about this today. This is one of a tragic proportion. I can tell you for free that we're in an epidemic, particularly in Nigeria. From the statistics you've given, you can see the dimension of the problem, the challenge we have as a people. Even in that, the 35 million drug users globally, Nigeria alone has 15 million of that.
Wow.
In terms of drug prevalence in the world, it's 5.6%. Nigeria is 14.4%. That is about 14 million people in the last 1 year had used drugs. And then if you then see the speed of affectation is about 15 to 64-year-olds.
Yes.
But we notice that the major area of affectation is 25 to 39, which is the productive sector of any society. So it's a huge problem in Africa, but more so in West Africa, because if you look at the study between Nigeria and Senegal, out of about 5 people, about 7 people, those two countries about 5 in terms of substance use. The commonest is obviously cannabis, not to talk of alcohol. So it's a major issue that Africa, particularly Nigeria, must begin to address. Or else in a few months, in a few years, the whole place will be filled with.
What are these social factors that are leading to people getting involved in drugs so much? When it comes to Africa is known to be a communal society where we have the family support. Everyone supports everyone. You lean on this, I lean on the, and so on. That togetherness forms a bond where if you have any challenge, you have any problem, there's someone to run to and all of that. And we're also very religious people where we have imams and pastors for counseling and all of that. Why do we still have the rising
You see, interestingly enough, you just touched some of the factors. Those are the supporters that have broken down. When we were growing up, people can bring you from the city and say, I saw your son. You can't do that today. One, many of the social factors aiding this, lack of employment, availability of those substances, and then curiosity, and then broken homes, and then dysfunctional families, absentee parenting, and then the fact that people want to experiment, they're young people. And one thing that is very clear today, there's a lack of cohesion in the family setup that you're just talking about, in which case you just see parents don't really have time anymore to interact with their children. There's no family discussion, there's no sitting down and on discussing. We take decisions on behalf of these young people that sometimes they do not appreciate, they have not been involved in it. So there is a gamut of circumstances we need to begin to consider if we want to deal with this.
All right, so let's look at the issues of treatment now. If Nigeria has to deal with this as much as possible, but then we don't have much time to talk about this. This conversation will definitely continue.
Now, when it comes to this drug abuse and awareness campaign, it has been on for quite a while. Yeah. But if we consider the economic, cultural, social challenges or issues that surround us on a daily basis, the realities of living here, as we all often talk about it, how challenging is it to reduce these numbers and the statistics of people who are involved in drug abuse?
To be quite honest with you, I like the word you use, reducing. You cannot eliminate it, but we can reduce it. Right. But it's a concerted effort that is involved. And one of the things that I always talk about, that I challenge the authorities with it, we must understand the fundamentals of this thing. You see, we cannot just come because there's a drug problem and then we just do drastic things like banning and that's not the way to go. I think we need to sit down, understand it, understand the dynamics of the global drug trade, and even particularly Africa and West Africa, and even in Nigeria. And then when we do that, we begin to understand what do we need to do. I think one of the things that would be a high point is sensitization awareness, advocacy steps, and all. Yes, rehabilitation is good, but that is coming rather late because the man is already addicted. How do we get a lot of people? You see, in any economic situation, it's supply and demand. If you can take away demand supply will reduce or fizzle out. We can't stop it. But the thing is, we must help our people to have an understanding that, look, this is the issue, and understand the society. Look, for instance, if we take away stigmatization, and a lot of people will come out to speak about their challenges, and then when they know that there's a second chance for them, a lot, like we accepted HIV/AIDS, because today we know that addiction is a public health issue. And we need to.
But we all appreciate the amount of resources that went into campaigns and advocacy for HIV/AIDS creation, awareness creation.
Right. But you know, the thing is, there's still a substantial level of denial in Nigeria.
Okay.
I can tell you that there's hardly a household in this country that do not have a challenge. But nobody wants to talk about it, because when you talk about it, a drug person, a victim, I call them victims. We call anybody who uses drugs, particularly students, young people, call them addicts. They're not addicts. They're just social users, occasional users, first-time users, experimental users. We need to understand the difference. Addiction is when somebody is totally involved in a chronic situation when the person can't do without drugs. And usually they are not engaged in something productive. They're probably living in drug joints or something. Those are different. And there must be different ways of dealing with it. And when we see a student use it, we expel them. That's not the right way to deal with it. Okay. That is double jeopardy.
Let's look at some persons believe that some of this addiction are spiritual problems. Absolutely. I wonder what do you make of that, and how that complicates the process of even trying to treat people who find themselves
They are not totally wrong. But what I mean is, there's hardly anything that a man does that does not have a spiritual connotation. In any management of any condition, there must be a holistic approach to it. You see, because there are some people, for instance, in the ministry that I'm involved in, it's called Christ Against Drug Abuse Ministry. There's a spiritual component to it. You see, you cannot take something away from someone and not put something back. Yeah. But I do not subscribe to when you say you carry him to church and you begin to pray. That's not the way to deal with it. I don't deal in that direction. But what I deal with, the spiritual component of the component of a man, there's a spirit, there's a mind, there's a soul. Yes. So you need to address the various components of the human person. And so that's the way I ascribe to the spirituality of it. But it's not to put him in a church and begin to pray. I tell you one thing, if you also go to the joints, which I go regularly, you will see there's also a belief in fetishness. Yeah. They hang all kinds of things, they pronounce things on people's names. So again, you need to disannul that. So there are various components of dealing with it that we need to understand.
Absolutely.
You know.
So it's a wholesome approach to...
Holistic approach.
All right.
Now, let's look at treatment, because according to the UN report, most countries have fallen short. How is this complicating efforts?
It's complicated because people who seek treatment from wanting to stop don't have access to it, either because there's no opportunity, or the charges, or they don't even they understand that they can seek treatment. So it's complicating the matter, and then so it leaves them frustrated, and they continue, and they lure other people into substance abuse.
If we have to focus on prevention from which they say is better than cure. Very so many young people these days, they watch TV, they have access to phones, have access to internet, other things that can lure them into all of these things. What should parents and even all of us, what should we be focusing on in the way of preventing more people?
You see, the more knowledge that we have about the occurrence, then people can understand. You see, the thing is, even if you're going to decide to do substance, know the consequences. Okay. Then you can then decide that is making informed choices. I know this is the consequence, I know this idea, but I choose to, for whatever reason. Then a man has, but they don't even have the opportunity of that knowledge. It's not that the knowledge is not available, but many times we don't even care to seek the knowledge. Many parents don't even know the kids do drugs, even right in the house. The fact that the child does not go to the joint does not mean he's not doing drugs. There are other avenues. They can order online. They can, on their phone, they can have the dealer's number and call the dealer who supplies the make guard and who gives the child at home. I think one of the things we really should look at is begin to talk to people about it, even put in a part of the curriculum in schools, but not in the very junior schools, but maybe from about secondary school, and everybody gets to understand. And then parents also get to understand and then go through the religious bodies and then to get to parents. And parents must be parents again. If we don't do all those things starting from the home, our sensitization is being like...
I like the line, parents must be parents again.
Absolutely.
Yeah.
Absolutely.
Indeed. All right, so let's leave it at this point because we've run short of time. But thank you so much, Dr. Dukwu and Dideji, for your time.
My pleasure.
Thank you very much.
Thank you.
And parents must be parents again.